Hey there! Today we're going to examine determinants of obesity in the United States. We'll begin by examining the problem itself, followed by the reasons for current obesity rates, and finally, ways of impacting the problem. So let's begin. During the past 30 years, obesity rates in the United States have skyrocketed. These maps from the Center for Disease Control and Prevention show the increasing prevalence of adulthood obesity between the years 1985 and 2010. In 1985, only 8 states reported adult obesity prevalence levels of 10 to 14%, but by 1990, 34 states reported obesity prevalence at that level. By the time 1995 rolled around, 27 states had prevalence levels of 15 to 19%, which is the dark blue color on the maps. In the year 2000, 22 states reached obesity prevalence levels of 20 to 24%. And by 2005, 3 states reported levels of obesity prevalence of 30% or more. By 2010, the number of states reporting obesity levels of 30% or more expanded to a whopping 12 states. Obesity prevalence among children has also increased dramatically during the past decade. Between 2003 and 2011, the number of states that reported childhood obesity prevalence of 10 to 14% increased from 22 to 27 states. Additionally, the number of states that reported prevalence of between 15 and 19% grew from 3 to 12. So you might be wondering, why are obesity rates increasing, and how did this become such a problem? Well, recent studies show that energy-dense foods composed of refined grains, added sugars, and fats oftentimes provide the lowest cost option for consumers. One study found that each additional 100 grams of fats and sweets actually reduced diet costs by 7 to 54 cents per day, whereas each additional 100 grams of fruits and veggies increased diet costs by 24 to 39 cents per day. Access to a grocery store versus a convenience store impacts both diet choices and expenses. Research indicates that grocery stores offer more healthy food options compared to food marts or convenience stores. For example, one study found that 75 to 100% of grocery stores carry low or non-fat milk, apples, high-fiber bread, and eggs, whereas only 4 to 29% of convenience stores offer similar options. Studies also show substantial cost increases for consumers who buy the limited healthy food options available at convenience stores. A banana at a convenience store such as 7-Eleven costs 79 cents. A 7-Eleven apple will run you $1.06. Just make sure that the jeering donuts don't draw you in first. At a supermarket like Publix, on the other hand, each banana is only about 28 cents, and an apple will cost you 80. Over the course of a year, a consumer who eats a banana and an apple a day could save over $285 simply by buying from a grocery instead of a convenience store. Now let's take a look at an example of food access issues in California. Marin County is the wealthiest county in California with a median household income of approximately $89,000, a population of roughly 256,000 people, and a land area of 828 square miles. Imperial County, on the other hand, represents California's poorest county, with the median household income of just about $39,000. A closer look at Marin County using Google Maps search tools reveals 18 grocery stores and just 8 convenience stores. Imperial County has only 9 grocery stores, but 15 convenience stores. So what does this all mean? First, Imperial County, the poorest county in California, has fewer grocery stores but more convenience stores per person and per 1,000 square miles than the wealthier county of Marin. This data suggests that healthy foods may be even less accessible and more costly in communities that have fewer supermarkets and more convenience stores. So how can we change food access to address the rising rates of obesity? First, policy developers should aim to reduce the cost of nutritious foods and also provide access to grocery stores in poorly served areas. In the meantime, we as consumers can make smart, healthy choices. For example, buying in-season fruits and vegetables, non-perishable items in bulk, and skipping prepackaged foods can all lighten the burden on your wallet. Thanks for watching and enjoy your apple a day.